With school starting next week, experts say outbreaks of COVID are inevitable. The question really is, how will cases trend in and out of schools as we move through the fall? ABC4's Nick McGurk spoke with an expert about the models and what they may predict.
The numbers are sobering. We spoke to the State Bureau of Epidemiology today, went through some projections, and what we look like is a lot like what it looked like over the last year. Waves, late fall of last year, into the early part of 2021. May not be as severe number-wise, but expect the wave that we're on now. It hasn't crested yet. We could see similar patterns all the way into next summer and beyond.
It will probably continue to get worse.
But what does worse look like? Since June, weekly COVID cases have spiked in Utah. Sam Lefevre runs the State Bureau of Epidemiology. He says his prediction is we'll see continued rise in daily cases, if not as dramatic as we saw over the last month.
In the area of 800 to 1,200 cases per day for a while.
A month from now, he predicts that we hit that 1,200 daily case average, then we likely plateau at that average well into October. After a fall plateau, Lefevre expects another holiday spike in cases. Keep in mind the modeling does not account for schools reopening, state law banning any kind of mask mandate.
It's hard to predict what this school year will look like compared to last year.
Fewer control measures in schools, for example. He says the Delta variant being more transmissible. And then on the other hand, there's more students who have likely had the virus already and will likely carry those antibodies that boost immunity. Also, with vaccines available this year, and they weren't available last year, now there's a percentage of family members who likely have been vaccinated.
We've got to defend those hospitals.
But Lefevre says more important than these case averages is the real strain on hospitals.
They're just burning out.
Hospital staff members are leaving the field, he says. People who delayed elective surgeries for 18 months are now filling beds. He says this winter could be worse than last, even though then daily cases hit 4,000 and 5,000 in Utah.
While I don't think the case level will go up as high as it was last year, I do think that it has the potential of getting worse.
The message, Lefevre says, is to get vaccinated. I did ask him about those vaccination numbers. He says they are creeping upward ever so slightly, about a 1% increase every week in those first shots. In Salt Lake, I'm Nick McGurk, ABC4 News.
Coming up, Jared.